It is very unusual for us to see flu this late in the influenza season. Hence why we were quite concerned, because it's been a long time since people had their seasonal flu vaccine and immunity might be waning. We started picking up some cases at the beginning of April, and we have had an outbreak of flu on a hospital ward that's been well managed, well contained, early identification, and the affected inpatients were given antiviral medication. The reason we wanted to promote awareness of this in the public is because the symptoms of flu are very similar to the symptoms of COVID infection. People might be doing their own lateral flow tests now, which would say for COVID they are negative, and think that it's okay to potentially go and visit their relatives, for example, in hospital or in ERS. I would strongly encourage people that if they've got systemic symptoms, and by that mean like quite a high temperature, coughs, etc., please, even if you test negative for COVID, make sure that you're 24 hours after your fever is resolved before you go and see one of your loved ones. Influenza is a self-limiting infection, although it can be quite unpleasant for many people. It is normally self-limiting, and people can take, for example, paracetamol to help resolve the symptoms.
Well, we've had lockdowns over the last few years and we haven't seen a lot of flu. So could the flu this year come with a vengeance?
You're right, we've seen very low levels of flu circulating the last 2 years, and I think that's been as a result of decreased mixing and people wearing masks and thinking about respiratory hygiene. So it is not unsurprising that we're seeing now an increase in flu cases. As I would reflect, it's very late in the season for us to see flu, and we are concerned that the immunity from the vaccine is waning.
Well, as you say, we've still got COVID on our minds. What sort of an impact will this have on the health services?
It's too early to say at the moment in terms of how much pressure the additionality of flu is going to have on the health services, hence why we're taking a precautionary approach. The flu vaccine that was given last October is a good match for the circulating strain, and that is positive news. But we're keeping a very close eye and monitoring how flu spreads.